All right, let's dive in. Today, we're decoding one of the most important, yet honestly, one of the most misunderstood numbers in all of health, your HbA1c. If you've ever gotten this number from your doctor and just kind of nodded while secretly wondering what it really means, well, you are in the right place.
So picture this. You go to the doctor and they fit you with, your A1C is 7.2%. Okay, but what does that actually mean? It's not just about what you had for breakfast yesterday. We're going to break down what this single number is truly revealing about your health over the last 3 months.
Okay, let's pull back the curtain on the science here. To really get what that A1C number is all about, we have to start with what it's actually measuring, and that's something called glycated hemoglobin. Okay, so what on earth is that? Well, put simply, hemoglobin is this protein in your red blood cells. Its main job is to carry oxygen. Now, whenever sugar or glucose is floating around in your bloodstream, it has this tendency to, well, stick to this hemoglobin. So the A1C test, it's basically just measuring how sugar-coated your hemoglobin has become over time. So here's how that whole process, called glycation, actually works. You eat, glucose from your food enters your bloodstream, and right away it starts latching onto your hemoglobin. And this is a permanent connection. The key thing to remember here is super simple. The more glucose you've got in your blood, the more of this sticking is going to happen. And this is the secret sauce to why A1C gives you that long-term view. See, your red blood cells, they only live for about 120 days, or around 3 months. So the A1C test isn't just looking at today or yesterday. It's capturing the average amount of sugar coating across the entire life of these cells. It's like a 3-month highlight reel of your blood sugar control. This is probably the best way to think about it. Imagine your A1C is your blood sugar GPA. A daily finger prick test, that's like a pop quiz. It tells you your score in that one single moment. But the A1C, that's your final grade for the whole semester. It gives you the big picture, smoothing out all those daily ups and downs. Okay, so now we know what it is. The next big question is, what do the numbers actually mean? Let's take a look at the official A1C scoreboard. So these are the standard ranges that doctors use to classify where you're at. Anything under 5.7% is considered in the normal, healthy range. Now, if you're between 5.7% and 6.4%, you're in what's called the pre-diabetes range. Think of this as a yellow flag, a really important warning zone. And an A1C of 6.5% or higher, usually confirmed on 2 different tests, is the official threshold for a diabetes diagnosis. But, and this is so important, especially if you're already managing diabetes, that general target of less than 7%, it is not a one-size-fits-all rule. No way. Your perfect number really depends on your age, your overall health, your risk of low blood sugar, a whole bunch of things. That's why having that conversation with your doctor to set a personal target is absolutely crucial. So at this point, A1C seems pretty straightforward, right? It's a useful average. But here's the thing. It has this massive blind spot. And honestly, it's something most people just don't realize. Okay, check this out. Imagine 2 different people, person A and person B. They both have the exact same A1C, 7.0%. But their stories are completely different. Person A's blood sugar is super stable, just cruising along in a safe, tight range. Person B, on the other hand, is on a total roller coaster, swinging from dangerously low to damagingly high. Their average is the same, but person B is facing a much higher risk. And the A1C number all by itself completely hides that chaos. And this really gets to the hidden truth of the A1C. It just can't show you that day-to-day variability, those wild swings. It hides how often you might be having low blood sugar events because they get averaged out. And it definitely won't tell you if you're spiking sky high after every meal. It's just an average. And like we just saw, averages can be incredibly misleading. So how do we fill in these huge gaps in the story? Well, modern diabetes management has a perfect partner for the A1C that helps us see the complete picture. And that partner is called time in range, or TIR for short. Now, instead of looking at a 3-month average, TIR tells you the percentage of time your glucose is actually staying within your target range, day in and day out. This is a total shift from looking at the average to looking at the quality of your control. I love this comparison. Think of it like this. Your A1C is like the long-term climate forecast for your health. Is it generally sunny or generally stormy? Time in range, though, that's your real-time, hour-by-hour weather report. And you really need both to navigate your health safely and effectively. And the goal for most people managing diabetes is to spend over 70% of their day inside that healthy target zone. This metric gives you such a clearer, more actionable picture of what's happening day to day, and it helps you and your doctor make much smarter decisions about your care.
Okay, so we've got A1C, we've got TIR. Why does all this matter so much? Because improving these numbers, even by a tiny bit, has a huge direct impact on your health for years to come. Let's just focus on this one number for a second, -1%. Because bringing your A1C down by just one single percentage point is an absolutely massive win for your long-term health. And this isn't just a guess. A huge landmark study called the UKPDS proved just how powerful this is. They found that a 1% drop in A1C was linked to a staggering 37% drop in the small blood vessel complications, a 21% drop in diabetes-related deaths, and a 14% drop in heart attacks. I mean, that's just incredible. It's proof that every single point really, really matters. And here's the best part. You are in the driver's seat. You have the power to move that number. By focusing on these key areas, like keeping your carb intake consistent, getting regular physical activity, prioritizing a good night's sleep, and staying on top of your medications, you can absolutely take control of your A1C.
Of course, it helps to know what's actually working, right? And that's where tools like My Health Gheware can be a real game changer. They help you connect all the dots, your sleep, your meals, your activity, your glucose trends, all in one place. The AI helps you see the true cause and effect, so you can finally understand what's really moving your numbers.
So let's wrap up with this question. We know now that your A1C is a vital piece of the puzzle, but it's not the whole story. So armed with this new understanding, what's one thing you'll do to start seeing your complete glucose picture?
Thanks so much for joining me for this explainer. And just a reminder, this is all for educational purposes. You should always, always work with your own doctor or healthcare team to set and manage your personal health targets.